We have a clinical tool that is AI driven that helps healthcare providers deliver biopsychosocial care, so mental, physical, and social well-being for every person with a long-term condition, in every visit with every patient, every healthcare provider, by helping patients, people with diabetes, people with obesity, and other long-term conditions, better understand for themselves their broader lived experience. So how their diabetes management actually fits in the real world. So what we do in a sentence is we match a person's real life experience with optimal routine care.
Crazy.
Welcome. My name is Unity Stoakes, co-founder at StartUpHealth, and today we are speaking with Dr. Katharine Barnard, longtime health transformer in StartUpHealth and in a couple of our Health Moonshot communities, including the T1D Moonshot and Cardiometabolic Moonshot. We're going to be learning about the progress that Spotlight AQ has been making, and really in the age of AI, how they've become really an extraordinary co-pilot for providers, for systems, for pharma, for ACOs, for the leaders within healthcare to improve patient lives and the journey of treating patients. Stick around. It's going to be a dynamic conversation, learning about the progress in the age of AI. Hey, how are you?
How are you?
Nice to see you again.
You too. My 4-year-old is just asking if she can do my face paints for Halloween. I'm like, no.
Halloween is like, it's the best day of the year for kids. So,
Yeah.
what's the costume this year?
So, Alice, what are you going as this year? Skeleton, still skeleton. We're still going skeleton. We are.
Yes.
I know, right? See, it's a go-to. It's a go-to. Let's be honest.
I like those costumes you can just bring back every year, so you always have it.
Yeah, exactly. But the thing is, it actually has a mask, so I'm not sure how the face painting is going to pan out. But hey, we can always paint Dad.
So you're a few hours ahead. Is it already?
It's 5 o'clock. So it's
Yeah,
not.
so you'll wake up tomorrow and get right to Halloween. I've got a few more hours, so.
Yeah, no, but yes. So there's much excitement. There is, but it's cool though. And I've got my nieces coming over, and they're going to carve pumpkins and do face painting, and genuinely, it's just usual Halloween carnage, really.
I love it. There's certain things in the world that are almost universal, and having fun and doing these things with our families is hopefully one of them. So cool. Well, I want to catch up with you about all things Spotlight AQ. I know you've been blazing away. You've got a big challenge coming up. You've got all sorts of stuff, but maybe just to level set, remind the world what Spotlight AQ is doing, because I think it's very significant in the age of AI, what you're bringing to providers, to health systems, to payers. How do you describe it today?
Yes. So basically we have a clinical tool that is AI driven that helps healthcare providers deliver biopsychosocial care, so mental, physical, and social well-being for every person with a long-term condition, in every visit with every patient, every healthcare provider, by helping patients, people with diabetes, people with obesity, and other long-term conditions, better understand for themselves their broader lived experience. So how their diabetes management actually fits in the real world. So what we do in a sentence is we match a person's real life experience with optimal routine care.
And then when that patient meets with the provider, there's almost like, it's like a co-pilot there that makes that whole experience way more effective, efficient. Is that how that works?
Yeah, so what we do is that a person with diabetes, for example, up to a week before they come to clinic or immediately in the waiting room before their appointment, they'll either get an email, a text message, or a QR code they can scan as they come in on the iPad in the clinic. and they'll complete a questionnaire. It's AI driven. So imagine massive databases of questions, everyone with a mechanism of action to an improved physical, mental, or social health outcome. And it learned really quickly as they complete the survey which questions to send based on their unmet need, their priority concerns. So everybody will get around 25, 28 questions. It takes 3 minutes. It's really fast. They immediately present it with a graphic. The bigger the bubble, the bigger the problem. And that shows them in the moment, my diabetes management in the context of my life. That sometimes they cry or they'll look at you all shifty and they'll say, how do you? And we don't know, but you know, and now you have an option to tell us, you know, and you can link your CGM data to it, and that's all great. But what the provider gets is they get to see exactly what you get, but they also get access to safe, evidence-based resources mapped to every possible priority you can raise. So when you go into your visit with your doctor or your nurse or your educator, they see exactly the problem, how big a problem it is for you, and they are ready to meet that need.
And as we know, providers have such limited time with the patient. Is there like a dashboard there that just simplifies this and makes it really easy? So as they're going from patient to patient, they know exactly what to prioritize?
Yeah, exactly that. They get a dashboard, they get to see the glycemia outcomes, they get to see the psychosocial outcomes, and they get the resources. So by doing that, by streamlining that visit and making it very focused, very precision, personalized medicine, we shorten visits, we get much better glycemic outcomes, we get much better quality of life for patients, and importantly, we are cost saving to clinics, and we reduce significantly provider burnout. So, you know, sometimes when you get a solution that works for one stakeholder, it can create problems for others. But what we have done very purposefully at Spotlight AQ is we have created a solution that is focused on routine care so that all stakeholders benefit.
What are you hearing? What's the type of feedback that you're hearing from either in the UK versus the US versus other parts of the world, both from individual providers using this, but also from the systems level or payer level?
Yeah. So from providers, we get really powerful feedback. Everybody loves it. And it's been difficult to kind of, when you try to introduce it, there's a little bit of resistance because they'll think, well, you know, I don't want another thing to do. I don't want another thing to open on my computer. You know, if my patient just took my advice, you know, and we kind of go, yeah, I know all of these things historically, but imagine today is a new day. Try it and see if you like it. And if you don't like it, don't use it. Simple as that. So that kind of takes the heat out, you know. We're not asking people to buy it immediately. We're just saying, try it. Just try it and see if it works for you. So that has helped a lot. And we have had feedback. People laugh because everyone just kind of goes, oh my God, that's brilliant. They all are surprised at the simplicity and the effectiveness of it. And we have one guy, and he said to me, I was a little bit skeptical, but when I tried it, that made me the doctor I thought I would be when I went to medical school, and realized it wasn't that easy when I went into routine care. And I was just like, oh, bless you. But often the common things we hear from providers is, I've known this patient for 20 years. I did not know that about them. I didn't realize they were struggling in that way.
It's a more holistic kind of
Exactly.
lens into that relationship.
Yeah. And the thing is, this tool was always built for providers because there's loads of stuff out there for people with diabetes and other long-term conditions, good, bad, and indifferent. But there's a lot, you know, but there's nothing to help providers switch from that medical, physical focus to holistic care. They are trained in the medical model, they exist in the medical model, and all of their markers are medical model based. So even the ADA EASD precision pathway that came out this year, I think, if you look at that exemplar of care, nowhere on there does it say psychosocial. Nowhere. And yet everybody knows that these long-term conditions that living with diabetes, living with obesity, half of it is psychosocial.
You mentioned CGMs, you mentioned providers are apprehensive at first because it's yet another thing. How does this integrate with the other streams, the other medical records, the other data that is going on in the system or with the payers? What's that like? And is there any integration or is it totally separate?
Yeah, so currently we're kind of separate. So remember, like Dexcom Clarity used to be like a standalone, you know, and LibraView is a standalone. We're kind of like that. We are integrated with CGM. So within our platform, you can see any Libra data or any Dexcom sensor data, and it is time stamped for the last 2 weeks. So what you see when the patient has completed the survey, you will see time in range and AGP for the last 2 weeks, alongside the bubble graph that the survey has just presented the results of. And what that does is it tells you how much a person is in range, where the problem might be, and what is driving that from a behavioral or psychosocial perspective. So you can really contextualize glycemia in a person's real life.
Interesting. And so stepping up to the systems level or payers, what are they saying? And maybe, I don't know if you can talk about some of the partners, you work with a lot of great partners that you're working with. There's the NHS, there's also partners here in the US, there's other places in the world that you're doing things with. Can you share any insights there in terms of why a system wants to license this or integrate it into their entire workflow, why a payer wants to do that?
Yeah, so we are actually cost saving to payers in terms of using this in routine care. So we've done the cost effectiveness modeling in the UK. Then you can add into that the time saved in the visits, the reduced burnout, for example, the reduced churn in terms of turnover of healthcare providers. So if you were to look at rural areas, for example, where it's extremely difficult to recruit and retain healthcare providers, especially doctors, actually, if you can make the work-related quality of life better, cheaper, and still get really good outcomes for patients, then it's a no-brainer. It really is something that is worth doing. So we are working with Atrium Health. We're just setting up some of their primary care centres now. We are working in the UK in 8 primary care centres there and expanding across the ICSs. We're also speaking to other health systems in the States and payers in the States to kind of roll it out more broadly. I think a real benefit, if you think like next steps for what we do, is as a standalone platform, it really works, but it was never designed like that. So if you could integrate it into your connected care platform as a health system, you could then do something really special, because not only can you pull and be more precise in the resources that you offer, so you can pull past history, you can pull comorbidities, you can pull prescribing, etc. But almost everybody over 60 has at least 1, 2, 3 comorbidities. So because we shorten visits and because there is a lot of duplication in visits for long-term conditions, you can start to really break down those silos now. So instead of having a diabetes clinic on a Tuesday, an obesity clinic on a Wednesday, a cardiovascular clinic on a Thursday, you can see the same patient in one visit and address all of those comorbidities. So that's the value as we move forwards, to really embed in connected care, so that the cost savings will be cumulatively much greater. And then the other thing for doing that in terms of quality of life, actually, that I was talking to somebody about today, is you get PCPs and they specialize. Like some guys will specialize in diabetes, some guys will specialize in cardiovascular disease, whatever. Some guys will specialize in COPD. And what you can do is, if you're merging those visits, you can play to the specialty of the primary care doc, so they can see the patients that they're most interested in. And like the COPD patients can see the PCP that's most interested in that disease area. So actually then that further improves work-related quality of life, because you're really tailored to giving precise, high-quality healthcare in the area in which you're expert. which is pretty cool.
I love that. You mentioned a few moments ago a magic word, which is simplicity. Everything you've done, and I've seen the dashboards. It's beautiful, it's simple, it's elegant. And a lot of things you see in healthcare are very complicated. You got to think about it. You got to figure it out. It actually takes more time to use than saves. Seems like it's the exact opposite. Take us back to you and the genesis of Spotlight AQ. Why did you create this? And what's a little bit more about you and your background, how this came to be that then influenced what the solution you've made here?
Yeah. So I'm a professor of health psychology by trade. And I think what we've done really well over the last 20 years is to get very good at measuring things. And, so the pinnacle of that was we qualified the FDA. We are the only team ever to be FDA qualified for a personal reported outcome measure in diabetes. And we did that with the automated insulin delivery systems, the Inspire measures, with Corey Hood and Jill and Laurie Lafell. And they're great, but they're blunt because they're on a piece of paper. The minute you put a questionnaire on a piece of paper, it's necessarily blunt. But the FDA were very happy because it meant for the first time in diabetes, they could rigorously and consistently assess a mental health outcome alongside glycemia, a physical health outcome. And what I wanted to do was, it's not fair. What we failed to do, and myself included over the last 20 years, is we've run in parallel to clinical care. So we've got really good at measuring things and demonstrating the evidence base, but we've never really integrated to help clinicians benefit from that,
Right.
day job. So clinicians used to complain a lot and say to me, this is great, but how does it help me? And they're right. So you look at the empowerment philosophy, for example, that Marty Funnell and Bob Anderson wrote years and years ago. It's really powerful, but it's very difficult to implement in a tangible way in clinic. So I wanted to do something that took the psychosocial aspects of disease and make that embed easily in routine care alongside medical aspects. And the reason I chose clinic rather than an app, for example, is that every person should connect with a healthcare provider at least once a year. So if you can make that connection better for providers and for patients, then everybody wins. Everybody wins. And you can reduce inequalities in access to devices, to therapies, because all of the options are the same for everybody. So it doesn't matter what your background is. If the resource is appropriate for your need, it'll be presented as an option for you.
Amazing. Yeah, I came out of the world of the beginning of the quantified self movement and just everyday people measuring things about their own lives, their own health, their own well-being. And there was always a disconnect between that and then your relationship with your clinicians, your doctors, your health professionals in your life. And what's so nice to see is that gap being bridged today. So how many years have you been working on this? You've got a lot of exciting things in development. Is there anything you can share? I know you're doing stuff with T1D Moonshot and the Breakthrough Challenge. It's just an exciting time for you because you've worked so hard and you're at this like inflection point. And tell us where you're at. Tell us what's going on.
So we are shortlisted for the Breakthrough Type 1 Diabetes Israel Innovation Challenge. So we're down to the final 4, and I'm going to Tel Aviv on Saturday for the finals on Monday. So I'm super, super excited about that. We are now, we've finished our kind of evidence building. We're almost, our last pivotal trial in pediatrics and parents is completing in Harvard and Kansas currently. So our research, we know this works. We have a ton of publications and evidence to prove that it works. We've also bridged that gap now between research efficacy, which is lovely, and actual real world efficacy. So we put it out there to the like Barbara Davis Center, for example, guys at Scripps, half a dozen centers, and said, can you try it? And they told us very quickly what needed to change to make it frictionless in the workflow. And that was where the QR code came from, because they were like, well, who sends this out? And I was like, oh, the research nurse. So naive. And they went, do I look like I have a research nurse? And
Right.
Does a QR code help? You know? And they were like, so how is the patient going to get that? I said, I'm going to give you an iPad. What I'm going to do is I'm going to give you an iPad and they're just going to scan it. Okay. They went, fine. That works. So things like that. So, and then when the care plan comes out of the platform, there within the platform, so you can now copy to clipboard and put it straight in the patient letter or straight on the EMR, those kinds of things. So we've come on that journey, which has been fun and challenging and harrowing and brilliant, and now we're ready to launch, in a big way. So we've got contracts starting with Abbott, like I say, in the NHS in the UK. Abbott and Dexcom have both given us CGM integration, and we've got all of those contracts in place now, which is super exciting. We are focused primarily in the primary care space because we think that's where there's most value in the short term. So we're onboarding the guys at Atrium Health literally next week. And we brought the Diaphyte games, the director community offering, all the card games that kind of snuck out of nowhere, out of Ryan's kind of PhD by publication. He's been doing all of that for Spotlight. And it's Mark Clements and Boris Kovachev. It's their fault, okay? They were like, oh my God, you should do this game, right? It would be amazing. So we have this kind of range of card games now to improve communication and behavior. So we're partnering with Victor. Currently, we are partnering with Syneos Health in the States as a distributor for the Spotlight AQ platform and for the games. And the world has just gone completely mad, to be perfectly honest with you.
It has gone
we'd
completely
never get
mad.
there. And then we suddenly did, So
do you,
yeah.
Your forward momentum here, do you
Yeah.
like, or what do you love most about being a doctorpreneur, and what surprised you most?
It's hard. It's really hard. And in ways you would never know, that you just could not know. But it's so exciting. It's so much fun. And I love the challenge of it, even though you just bang your head against the wall sometimes. And it's just so hard. And you think, how will we ever get through? But you find a way. And I love it. For me, where do we go with this? I think I'm excited by what we've done, what we've achieved. We've proved it could be done. And that's all I ever wanted to do, was to prove that you could deliver in routine care for everybody biopsychosocial care. And it can be done, and it can be done in a brilliant way. What would I love to happen next? I'd love to bring on a CEO now who has got the expertise and the experience to really make this massive, because I'm not going to be able to do it justice for much longer, I think. But I think once we prove that we've got traction with the health systems and people are willing to buy, and we've now developed our business model and we know our costs and our price points and all of that stuff that I'd never heard of 3 years ago. Now I think we just need to get through the next 6 months to prove willingness to pay and traction. And then I'm hoping that we can then do an investment round and bring on a really world-class CEO to kind of fly with it and take it in directions that I can't even imagine.
Well, it's so interesting to hear you describe this, because building something significant, it's constant change, it's teams evolve, your plans evolve, your opportunities evolve. So it's exciting to hear your vision and your path forward and everything going on. And it's just, you're always so wonderful as part of the Startup Health community, because you bring what we like to say, batteries included, energy to the whole ecosystem. What's it been like for you being part of these Health Moonshot communities and interacting with other founders and other teams within the various moonshots and within Startup Health?
Oh, it's been amazing. I mean, literally, I wouldn't have changed it for the world. And what I love, and Steve asked me actually on the SWAT meeting the other week, he says, what's the one thing? And I was like, patience. You guys have the patience of a saint, because I am the worst. I am like, I'm quite an organized, structured person, but there's so much that you're just all over the place all of the time. And you can just dip in and out, you know, to the community, and you can ask a question and you can get feedback, and you could support somebody else, for example, or you could, but like, you guys are there and you understand this in a way that I never can. I never will. If I do this till I'm 100, I'll never have the kind of the understanding and the breadth of understanding that you guys have. We'll always get better at what I do, but there are like 50 other things that you guys are expert in that you bring to the table.
Well, it's what I love is we're 1 degree of separation. You have your expertise, others have their own, and you combine everybody together, and there's this extraordinary network of the best in their arena. And when you bring everybody together and they collaborate, oh, do we have the skeleton coming in?
Oh, hello.
I want to see the skeleton.
She's not wearing it. She's not ready yet. She's just like, she's still pink.
Oh, okay.
Pink. Yeah. But well, no, it is. And you want them to succeed, you know, and everyone kind of goes, oh, 99% of startups fail. But you just so desperately want the community to succeed, because whenever I've been on any of these calls, these guys are amazing. They've got brilliant like products and ideas. And you see that. And the other thing that is, I know it's awful, but sometimes it's quite reassuring to see that they're struggling too. Do you know what I mean? It's not, you're not just that.
You realize you're not alone. You're not alone. And it's such a struggle. It's a journey. It's a lonely journey. We have families. We're balancing our lives, all these things, and it's never easy. So it does feel good to know, hey, I'm not the only one experiencing these challenges. This is very normal. This is part of the process. This is part of the journey. And hey, let's help each other through it over time.
But being able to help somebody. So I don't think I could help anybody from a business perspective. And I wouldn't expect anybody to expect help from me, because like, genuinely. But as a psychologist and a scientist, and publishing a lot and all of that fun stuff. So there was a guy before the ADA with abstract for the whatever conference it was. And he clearly had stuff that he could present. And I said to him, and then we continued on offline for a while. And I said, you should put in an abstract to the ADA or whatever it was. Submit an abstract, because you have data, and then you can present that publication. So you're in Publishing Diabetes Care, you can present that as building your evidence base. And he just had not thought of it at all and didn't think he had anything. And I'm like, mate, let me take a look at that, because I think you've got something there. And he did. And he pulled it together and he submitted it. And that, being able to help in that way is nice as a community, because I'm never going to be able to help somebody from being a business.
No, you're selling yourself short. You help so the entire community. It's supercharged by everyone that's a part of it. So thank you for everything you're doing. Last question. Who do you want to meet? Who should be contacting you? A lot of people listen to this. You're meeting with providers, with payers, with systems, and you're an extraordinary, not just doctorpreneur, but mompreneur here.
Yeah, I know, right?
We want to make it, we want the right people to be connecting with you about Spotlight AQ, so that we can get this out to the world and help make the experience better for patients, for providers, for systems, etc.
Yeah, so people who are in decision-making positions. So, for example, after the swap, Jen introduced me to Albert Seals from Humana. So I'm speaking to him tomorrow night. So hopefully we can make progress in trying to get into there, you know. Any health system, anybody that could, that thinks that they would benefit from this, I would love to talk to them. In the next 6 months, I'd love to talk to investors who can see the vision of where we're going and maybe be able to give us some advice on how to do that raise. I think my next thing for Startup Health is around getting advice for the raise, you know. But I think before we can achieve the raise, before I want to ask people for money, I want to be able to say to them, look, we're in a really good space, and you should give us money because you'll make it back places.
You're the true spirit of an entrepreneur, mompreneur, and we're just so grateful to have you as part of our Health Moonshot communities and for everything you're doing. Sincerely, we're grateful and thankful that you're bringing this innovation and everything you've been working towards over the past decades to bring this to patients. So thank you.
Thank you so, so much. I'm so grateful. Thank you. And I'll
Well,
let
have
you
a
know
good
who
day
win
and
next
have a great
week.
Halloween.
Yeah, say happy Halloween.
Happy Halloween.
Yeah.
I wish I could see your costume. All right. See you soon.
Take care. Bye, honey. Bye, bye,
Bye.
bye.
Wow, that was great fun with Katharine Barnard-Kelly, doctorpreneur, mompreneur extraordinaire, the CEO and founder of Spotlight AQ. Please find them at spotlightaq.com, and we'd love to see them continue to thrive and grow, and reach out to Dr. Barnard-Kelly there. Thanks again, and we'll be in touch soon.